Hi, I'm Dr. Beth Molleson.
And I'm Dr. Katie Berlin.
Thanks for joining us here in the Veterinary Breakroom. And today we decided to chat about something a little bit more lighthearted than our usual topic, and that is our craziest client requests. So, Katie, I know we've both been in the clinic for, I hate to say, a decade or two now, which leaves lots of room for some good client stories and client requests. So I thought it would be fun to just share them again. Just take a moment for some levity. So any that come to the top of your head that you would like to share?
Well, I want to just start off by saying I feel like I want to be clear that we're not being negative about clients requesting things. I want clients to feel open and like they can ask for anything. But there are some things that people ask that you're just like, are you serious? Like, did you actually just say that?
That's a good call out. I definitely think somewhere right now, my either pediatrician or my own general practitioner is probably having a podcast about all the things I've said to them. So yes, this is certainly not done with judgment or
Right.
negative feelings, but just a moment to appreciate those moments that we all have in the clinic.
Yeah. And like I have to say a couple of my like craziest requests are also kind of heartwarming. So but they are also crazy. So like the one that I call the heart transplant guy is actually like really kind of bittersweet because it was a boxer. The boxer's name was Star. I remember this. And she was like a staple. It was a he. This was a long time ago. He was kind of like one of those patients like everybody in the hospital knows,
Mm-hmm.
and he was owned by this very, very elderly man. And Star, being a boxer, had a defective heart. And the very old man was wondering if he could somehow donate his heart to his dog. And I was about to say when he died, but he was not actually about to die. So the implication was, could I just stop using my heart and give it to my boxer? And he was absolutely serious. And it was like so sad and so sweet and so lovely. And also you're like, do I have to have this conversation with you? Like
Right. Do I need to answer from a medical perspective?
right. Because like medically, obviously you can't give your heart to your dog, but also like if you stop using it, what are you going to do? You know what I mean? And I wasn't sure if I had to explain
God.
that or not. Like it just seemed very dicey territory to me. So anyway, so that was
That
one of
is
them.
very sweet, but a bit depressing, Katie. I promised lighthearted.
I know.
You
I'm
took us
sorry.
really.
That's why
No,
I started off with that one, so we have nowhere to go but up.
That's good. That is something though. I don't think I've had any transplant requests. I'm actually a little surprised it doesn't happen more often. But that's a good one. Okay, this one I will say is maybe more lighthearted. It's a dog that I was seeing. I think it just, has some lower urinary tract signs. And so I had it come in for a urinalysis. But when the pet owner got there, she said, "Good news, I already checked its urine to save some money because I have a microscope." And she had looked at her dog's urine under the microscope and gave me an index card. And she had sketched out what she had seen under the microscope so that I could interpret that and she could save some money. So I
Wow.
thought that was really something. But it was sort of the same situation where I was like, I didn't think I'd find myself having to medically explain why your pencil sketch of whatever sort of cell this isn't going to cut it for me medically.
Yeah. Wow. I thought you were going to say she took pictures, which like that might be okay, Like I still would be like I probably need to see the sample myself, but at least then it would be like a visual representation of what was actually there versus like.
That's probably why I remember it. If she had just shown me pictures, it wouldn't have been as memorable. It would have just been another like, oh, no,
Yeah.
would have moved on quickly. But this I remember. I remember the index card, and I wish I still had it.
I did have a client who asked me if their dentist could assist me in their dog's dental
Oh.
and maybe do some of the extractions. And we didn't even get to the part about like, would I charge for the extractions or would the dentist charge for the extractions or would they be free? Because this is clearly like human dentist who had no idea how to take out a dog's tooth. But it just like there were just layers of this request that were so not happening.
Did you feel like that was a pretty serious request?
Oh, it was absolutely a serious request. Yeah, this
Do
was
you think the
100% serious.
dentist was aware of the request?
Well, I don't know because like I never thankfully had to call the dentist and talk to them, but like the owner said, "Oh, I told my dentist that my dog was having a dental and was probably going to have some extractions." And the dentist got like super excited and said, "I've never seen a dog extraction." I'm like, I wonder if she would let me. Anyway, that was the story that I got. And I hate to let the dentist down. Like, I'm all for One Health, you know? Like, I want to collaborate with the human medical profession, but also, no.
Yeah. I used to say, does the dentist know how much money it would be losing, he or she would be losing taking the whole morning off to watch you do a dental? Yeah, the logistics of it don't seem
Right. And then
feasible.
I can just imagine like what the dentist would tell the client potentially
Mhm.
about like how I was taking a tooth out or like, well, in human medicine, we would save this tooth and here's how, you know. Anyway, I saw some red flags. So
I'm
no.
glad you nipped that in the bud.
Yeah.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
Okay, this one I have a feeling a lot of people might be able to relate at least to some version of this story. That is, I had a dog come in. The owner was convinced that it had lice. It did have some seborrheic dermatitis, so I think it was just dandruff. I looked at the pieces of dandruff under the microscope so we could confirm there was not lice present. And then she said, "Okay, but can you also do that with these things in my hair because my scalp is itchy?" And she proceeded to take off some of her own debris or lice. I don't know because I did not look at it under the microscope. So I
Did
feel
you
like that
then?
falls in the realm of like the rash category that I know a lot of us have stories in.
Absolutely. Yeah, absolutely. Did you then sterilize the entire room?
Yes,
Because,
I
like,
explained. This was even after I had explained that lice is species specific, so we're actually in pretty good shape here. So if you
right.
have lice,
I mean,
that is not in my jurisdiction
that's
whatsoever.
right. It's absolutely not your business or your concern, other
Mhm.
than please don't shake your head in my presence or like rest it on anything.
Yep, or hand me whatever thing you've just pulled off of your scalp.
um, okay, well, I feel like I need to end with the one that we're all wondering about because I wrote it down for you, and it's called in my outline. It's called the testicle guy because testicle guy was not that dissimilar from heart transplant guy, except that he wanted to donate one of his testicles to his dog.
Sorry, I was afraid we were going.
Yeah. And I gotta say, like sometimes when people are talking about testicles, you can't 100, especially unexpectedly, like you can't 100% gauge the seriousness. But he looked very earnest. Like I think he got a little teary, if I remember, because he was like so sad at the thought of his dog not having testicles. And I was like, I remember thinking, should I bring up the nudicle conversation? Because I've never
Mhm.
done that, but like, is he just worried about it being empty or like a
Mhm.
perception thing? Because it's not like his testicle was going to work. and then they were both only going to have one. You know, I mean, of all the problems, that's two of the problems.
Dare I ask if you probed enough to figure out what the motives were?
Don't say probed. No, I did not. I felt like that was not relevant. So, I mean,
I want to know so badly.
I know. I did explain, that like for dogs, especially just like pet dogs who aren't show dogs, there's really no cosmetic or medical benefit to filling that space. But also, like, since I wasn't 100% sure that he was completely serious, I didn't want to spend too much time talking about it, because
the anatomy of it
then
all.
he'd be like, hey, I really had my vet going because I told her I wanted to donate my testicle to the dog.
Yeah,
so
you
it's
have
like
to
that
be
gray area of like, am I getting punked? Or
yeah, you don't want to look too gullible,
right? But I also don't want to like make light of this conversation because you're not laughing.
It's a very fine balance.
Yeah, so that was Testicle Guy, and the dog got neutered and everything was fine, and
okay, good.
Hopefully everyone recovered emotionally.
Yep, that's all we can say there, I think.
Yep.
I like that one. Okay, my last one for you, Katie, not nearly as good as Testicle Guy. I'm gonna call her Textbook Woman, and she showed up. She had a lot of cats at home, very into her cats. They were having a few of them were having a series of upper respiratory symptoms. So she brought the cats in and presented them to me. And she said, oh, good news. I found my textbook and I think it's this. And she had basically found a textbook from 1972. I remember the year, textbook from 1972 about feline herpes. And she was very excited that she could educate me on feline herpes with her textbook. And so she requested that I read it, and I did. And sure enough, it was all about feline herpes. And there's another one of those requests where I'm like, this is so well intentioned that I don't want to, like, do I lead on that I've heard of feline herpes before, or do I let it take the course of being very grateful that she shared this knowledge so that we could get some potential answers for her cats?
That is a tough one, because like most likely it was feline herpes. Like that's the other part of it. It's like it probably was. And I don't know how much has changed about feline herpes since 1972. I mean, herpes is herpes, but like
I think it's a good takeaway. Yeah, I should actually, you're right, because that story could have gone in a different direction where there was a much different clinical diagnosis that she had made. But no, I think that was actually spot on. It was more of the fact that she thought she had found some really novel information to share with the veterinary community.
Yeah. I mean, God love her.
I would say, I think the common thing here with all these requests is how well-intentioned they all were.
Absolutely. I mean, Testicle Guy like just didn't want his dog to be without testicle. And I respect that, because that shows a deep level of caring. So in the spirit of this discussion, let's end with a win of the week that has to do with something nice or cute that a client did. Beth, do you have something?
I love that. Yes, I immediately thought of a pet owner. I guess you could say this was a request, because she was very nervous, I could tell, to ask me this, but she wanted to ask we had euthanized her dog. It was this little Yorkie that, of course, had been coming to us for forever, had, really bonded to this pet owner. And the Yorkie used to wear different sweaters to come in, no matter the weather. This dog always had a sweater on. And there was one that had her name stitched onto it that was just like her Hallmark sweater. And I loved it because it was like bedazzled. So I just always thought it was hysterical and would always comment on it. And so her owner asked if I would want it. I think she was nervous. She thought it was a weird request, but she asked me if I would want it. Of course, the answer was absolutely yes. So that's my sweet, heartwarming moment. So yeah, I have a tiny little Sadie sweater.
That's adorable. Oh, I love that so much.
I know.
So mine is actually from back in 2020 when we were seeing curbside appointments exclusively. And so like I didn't see the face of most clients. I
Sure.
usually offered them like a video call or something like but most people were fine with just the phone. And so and, and there were like 6 patients in the hospital at one time, and so like, owners I think were trying to like maybe distinguish themselves and make sure that they were being associated with the right pet. And I got this one cat in for an exam, and the owner had sent in like an index, like a big index card, as a note to make sure that I addressed all of his concerns. And it was really cute. It was like a bulleted list of like all of his questions about his cat. You could tell he was like, it was like a man and his cat, like this was the family, like this
A
man
duo.
and this cat.
Mhm.
And he signed it Matt, cat dad. And I will always remember that because I just thought that was the cutest thing in the world. Like it wasn't his last name. It was like Matt, cat dad.
Oh, like
And
his
I
most
just,
distinguished identifying
yeah,
descriptor of
yeah,
himself.
yeah.
Yeah.
I just thought it was adorable. And for some reason that stuck in my head. So Matt, cat dad,
Oh, I hope
kudos.
he and Kat are doing well. That's really sweet.
Me too. And like we all needed just little teeny pick me ups like that during COVID. Like it was so terrible and we were all so frustrated and scared and all the things. And so Matt, cat dad, made me smile that day. So
I love it. I
also,
was going to say, I think in this profession, the things that keep us going are one, the funny client stories, and two, those heartwarming moments that sometimes feel few and far between, but really do keep us going.
yeah, like it sometimes feels like, clients, we know they care, but sometimes you could see it more than others. And a little note like that, like you could just tell how much Matt, cat dad, really cared about his cat.
Absolutely. Shined through. Well, fantastic. Thank you all for joining us in the Veterinary Break Room today. We will catch you all next episode. Thank you for joining us in the Veterinary Break Room. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@instinct.vet. Veterinary Break Room is an Instinct Science production, produced by Alexis Ussery and co-hosted by Alyssa Watson, Beth Molleson, and Katie Berlin.